Thank you for checking out Dr. Christine Greves' website. I'm sitting down with her today to talk about all of your most important questions about the female body. So let's dive right in. Dr. Greves, for my friend who's pregnant, how does she know when it's the right time to go to the hospital? Is there anything she can do to be prepared for that really important time?
It's a great question. I get asked that a lot. Sometimes you don't know, but that's what we're here for you for that. Okay, so what I like to recommend is if your pregnancy is going well and is low risk, go ahead and start having a bag packed in your car or have it readily accessible at home for someone to grab. A bag that could have certain things that would provide extra comfort for you. Go ahead and work on your music playlist, for example, because that's something that may give you peace. So I recommend you be prepared in that way. Everybody wants to know, what can I do to be prepared? Go ahead and have that bag packed. Sure, you can take a tour of the hospital. You definitely come in for your prenatal care visits, but that never really gets you to that point of wondering, am I in labor? So here you go. Contractions. Ask yourself, are these contractions like to where your uterus feels like it's a big basketball squeezing and releasing, squeezing and releasing? Are these contractions becoming more regular and more painful? Are you having them every 5 minutes? If that's the case and it's been persistent, you may be going into labor. And it persists for over an hour. You may be able to you may be going into labor. Ask yourself, did I drink enough water today? What was my activity level? Because if you didn't drink enough water, then sometimes your uterus contracts because of that. Or it can be those Braxton Hicks contractions that you may have heard of that are fake contractions that are not going to put you into labor. So you could save yourself some questioning if you make sure you stay very well hydrated throughout your pregnancy and you rest when your body tells you to rest. So contractions number 1, okay? Regular contractions, painful contractions. Is that happening? Number 2, did you break your bag of water? And sometimes I tell people, does it feel like a big bucket of water came down your leg? Or does it feel like a slow trickle? Is it different, like a watery trickle? Either could be changes, which could be concerns, and that would prompt you to need to go get evaluated. Because if you broke your bag of water, meaning your amniotic sac, then you do need to get seen. You do need to make sure everything's okay with your pregnancy, and it may be your great day to where you're going to be admitted and have your baby later. Then bleeding. Is bleeding ever normal in the 3rd trimester of pregnancy? No. If you are having bleeding, make sure that you go in, get assessed. And when I say go in, at our facility, we have a triage area where people go in, they get evaluated. It's like a women's emergency department. And then that way they can be assessed whether they need to stay in the hospital or not. And then the other component is this is not labor, but you need to make sure that your baby's moving well. If your baby's activity level has changed, that could be meaning that your baby may want to come out sooner. So if your baby's movement has gone down, if you've noticed a change, make sure you let us know that, because movement is a sign of fetal well-being. So anyway, let's say that you are contracting regularly, you broke your bag of water, you're having bleeding, or noticing that your baby is not moving as well. Go to triage, go to call your doctor, get assessed, and then we can jump to part 2 of what happens if that is your lucky day to when you get to go to the hospital to have your baby for labor and delivery.